Maybe you want to become pregnant, you're having a deficiency, or you're using the drug methotrexate. In these cases, your doctor might have prescribed you folic acid and you now want to know how to use it. Then this video is meant for you. We will cover how and when to use it, what side effects it can cause, what dosage you need, and much more. So make sure to watch the whole video so you don't miss any important information. For those of you who are meeting for the first time, my name is Raoul, I'm a medical doctor from the Netherlands, and it's my mission to educate you, my viewer, because educated people make healthier decisions. So let's get learning. So as mentioned, the generic name of this medication is folic acid and is available as a tablet. If you want to use it, just swallow it whole with half a glass of water, and it's best to do so at a fixed time each day, so you're less likely to forget your dose. Folic acid is converted into tetrahydrofolic acid in your gut and your liver. This plays an important role in the production of various building materials in your body and the production of red blood cells. Therefore, folic acid can be used to treat anemia caused due to a folic acid deficiency. For the same reasons, it can be used preventatively in people with resorption disorder or chronic alcoholism. Furthermore, it can also be used in pregnancy to reduce the chances of neural tube defects in your fetus. And lastly, it can be used to reduce side effects in methotrexate. Which brings us to the correct dosages to use. And here I want to mention that you should only use the prescribed amount and frequency your doctor gave you, as specific dosages might depend on the indication of use, severity of your symptoms, and the side effects you might experience. However, when using folic acid to treat deficiencies, your doctor might prescribe an initial dose of 0.5 to 1 milligrams per day. After disappearance of your symptoms, the maintenance dose might be lowered to 0.25 to 0.5 milligrams per day. When prescribing it for women who want to become pregnant, your doctor might prescribe a dose of 0.4 to 0.5 milligrams per day for at least 4 weeks up until 12 weeks after the conception. Now, unfortunately, folic acid is a very effective drug which can also cause some side effects. I will discuss some of the most common ones in this video, but if you're looking for a complete list, then ask your pharmacist, your doctor, or check your leaflet. Rarely it can cause hypersensitivity reactions, a fever and a rash, and very rarely it might cause gastrointestinal complaints, sleeping disorder, depression, and irritability. Which brings us to the safety of use. And here I want to mention that folic acid can be combined with any type of food, and it can be combined with alcohol, and is also safe to drive when using folic acid. However, it can have interactions with other drugs you're taking, so always discuss this with your personal doctor. Now, I hope you know now how to use folic acid, but if you have any questions, let me know in the comment section, and I will do my best to answer each and every one of them. For those of you that want to keep on learning, check out the playlist in the description as well, and I'm posting weekly content on Facebook and Instagram. You can see my other content there. Lastly, it would mean the world to me if you click the like and subscribe button. This will help out the channel tremendously, and in return you will get a notification each week with a new awesome video. Thank you so much, and I will see you next week with a new video. Bye bye.